Hello, happy Saturday. Let's give it a couple of moments for you to tune in. Today, we're talking about hormonal balance, pretty much the foundation of it, what it is, and how you can address it with endometriosis. Welcome. Awesome, welcome. As usual, I will be using slides so that you can get some visual information that you can save for your reference for later. While the slides are up, the comments will be turned off so that nobody is distracted. After I'm done with my presentation, that will take 15, maybe 20 minutes, I will open up the comments and you can ask any question that you have. Well, let's begin. If you can still see me and hear me, could you give me some hearts? I want to make sure I didn't lose you. Okay, great. Welcome. I'm going to turn the comments off and we are going to start. Welcome to the session on hormonal balance and endometriosis. My name is Anastasia Hackler. I am an endo warrior just like you. My own healing journey started back in 2014 when I was officially diagnosed. Before that, I knew nothing about health-oriented living, organic or non-GMO foods. I did not really exercise or take any supplements. And because for 19 years I believed what doctors told me, that my pain was normal, my infertility was my fault, and that I would have to spend till I'm 50, till I'm menopausal, I'll have to spend that time taking birth control and pain medications. My diagnosis in 2014 actually saved me because it gave me the name for my pain and I started looking for tools to fight it. I found them, and since 2017, I have been endometriosis symptoms free, and for the past year and a half, I have helped dozens of other women get relief from endometriosis symptoms using the program that I created called 90-Day Endo Hack Plan. Here you can read about my background. I'm not going to go over that. Let's talk about the topic at hand. So, hormonal balance. Before I proceed, this video is for informational purposes only. It is not intended to treat, cure, or diagnose anything. Always consult with your doctor if you have any medical questions. But endometriosis is more than just hormonal issues. A lot of literature and research on endometriosis is talking about this sex hormone aspect of the disease. But endometriosis is way more than just estrogen dominance and progesterone resistance. Addressing your overall hormonal balance is a part of a whole body approach because hormonal balance affects so many different areas of our life and of our health that can be contributing to the endometriosis flare-ups and endometriosis growth. Why are hormones so important? Well, because they literally control everything in our life. Our hormones are like light switches. They turn on and off different processes and different functions in our body every single second. They are the ones that determine when you fall asleep, when you wake up, if you are full or if you feel hungry. They determine if you're happy, if you're sad, and even if you're cold or hot, and so many other things. There are like over 50 hormones in our body, and they have to work together and they have to be in balance. And today I will share with you some important ones to address that you can do without any medication. There is a connection between endometriosis and hormones, of course, because a lot of endometriosis warriors are recommended or go through hysterectomy. Hysterectomies are basically this brutal and very outdated treatment for endo. Hysterectomies do not cure endometriosis. Specifically, I'm not talking about adenomyosis, just endometriosis. And women who have had their ovaries or uterus removed all of a sudden start having focus and memory problems because of a very big drop of estrogen. So too much estrogen is not good, but too low estrogen is not great either. Patients that have endometriosis are more likely to experience mood swings, depression, and anxiety. Our hormones are affecting some inflammatory events in our body, causing a lot of inflammation. The change in hormone levels can make your food pass through your stomach either fast, and then you get diarrhea, nausea, and stomach pain, or on the contrary, pass very slow, and then we end up with constipation, gas, and bloating. And those sound so familiar, right? Those are our everyday symptoms. So how do you balance those hormones and do it all at once? Well, to balance your hormones, you need to make sure that your control system, that breaker that controls all of the light switches, is in check. But what is it? It is how you deal with stress and how you respond to stress. Because stress starts a chain reaction of events in our body every single time. It affects different hormones simultaneously, like this domino effect. When we talk about stress, the main hormone that we think about is cortisol. Cortisol is produced by these little tiny glands on top of our kidneys called adrenal glands. So when your body perceives stress, and it may happen when you're laying in bed just scrolling through your phone, when that happens, your adrenal glands release cortisol into your bloodstream. The release of cortisol makes your heart beat faster. That in turn intensifies your breathing, and that sends a signal to your brain saying that, hello, there is a danger, flight or fight mode needs to be turned on. And when that happens, your blood sugar goes up so that it can get to your muscles so that you can run. Your blood pressure goes up so that you have strength to fight. You get energy because you need to be wired and alert. But when it comes to reproduction, libido, sleep and relaxation, or digestion, those functions are temporarily shut down because they are considered non-vital to survival. And that is totally normal. This is a normal reaction to an acute situation. What is not normal is when we stay in a stressed mode for a prolonged period of time. That is what messes up our hormonal level. To illustrate it even more, cortisol is like a brake system in your car. You can have all of the good hormones, you can have a good amount of those, but if your brake is on, your car is not going anywhere. You can press on the gas all you want, but the car will just overheat and you will cause more damage. Cortisol is extremely important to address. It's more important than progesterone, estrogen, testosterone, and it needs to be optimized every single day of our life, because it's not all about the hormones themselves. It's about whether those hormones are able to get into the cell to do what they're supposed to do. And all of that is in the hands of the cortisol. If there is a lot of free-floating cortisol in your bloodstream, then your brake is on. And your body is thinking, no, we cannot take this hormone in because we are in a stressed mode right now. So cortisol needs to be balanced. Too much of it causes inflammation. Too little of it causes pain. And those are two words that we hear all the time with endometriosis, right? Endometriosis warriors go through this cycle when we have constant stressors in the form of pain, doctor visits, social anxiety, and you name it. You know what I'm talking about. We get this constant cortisol release because of chronic stress, and it causes inflammation, and our gut shuts down, and all of the other problems and functions that are vital to us but are not vital to survival are not working. When this happens for a prolonged period of time, our adrenal glands get wore out. They get burnt out because they keep releasing and releasing cortisol, and we start getting low cortisol. And when that happens, we get fatigue on waking up and throughout the day. We get brain fog. We get things like cravings, crazy cravings for sugary and salty things, and also sudden bursts of energy in the evening. And on top of that, we end up with pain. And we go through the cycle over and over and over. From pain to inflammation, from inflammation to pain. So how do you balance this? Well, first and foremost, it's about building resilience, and building good stress management. Okay? There are different techniques to do that. I will share some with you today, and then if you would like to learn more, let me know. I will send you a free video with a lot more information on this. But the first tip that I would give you is pay attention to the way you breathe. Pay attention to your breathing. Put reminders all over your house or the office that you work at. Put reminders in your phone to remind you to take a deep breath. We need to kind of reset, and that happens when we take a deep breath. And most of us breathe totally wrong. We need to learn how to breathe like babies do. So it needs to be a deep breath through your nose. You are expanding your belly when you're breathing in and sucking it in when you're breathing out. That's totally backwards from what we usually do, and it will take you some time to get adjusted to that. But if you can learn this breathing technique and do it throughout the day, deep breathing helps lower your cortisol levels, your heart rate, and it helps sending a signal to your brain saying that you're fine, you don't need any help, there is no stressor around you. But what if you have low cortisol already and you are fatigued and you're totally out of it? Well, there are things that stress out and burn out your adrenals. One of them is inconsistency. If you sleep and you eat at random times, your adrenals get burnt out just by that. So consistency with the meal time and sleep time is very important. Get on a routine. Routine is extremely important. We need to learn to relax. Our brain, if you think about it, our brain never shuts off. Especially if we're thinking, overthinking, overanalyzing, it's part of our job, or if we're constantly scrolling through so much information, our brain never stops. So learning to relax and shut it down and not think about stuff for some time will help you also and help your adrenals. Avoid intense workouts. I keep telling it to all endometriosis warriors. You are not going to lose weight no matter how big your weights are, no matter how intensely you work out. You are only going to stress your body out more. There are very gentle exercises that work just as good, and they are not as stressful to our adrenal glands. Of course, avoid sugar because it causes spike in cortisol. Caffeine because it causes chronic stress in chronic illness patients. And when you are on this diet of craving sugary things and drinking coffee to get energy, then you may suppress the cortisol level because your adrenals are totally burnt out, and it may make it very difficult for your body to even go through a stressful situation and process it. And if you're thinking, well, I go to bed at the same time, I eat great, everything is fine, but something is still not right with your cortisol level and your hormonal balance, then you can look into addressing fear. According to traditional Chinese medicine perspective, fear also burns our adrenal glands out. And I'm not talking about, something traumatic or something big and emotional. It can be as simple as a fear of loss. a fear of failure, a fear of disappointment. And just like me, you probably have a lot of fear in your life. You are fearing to disappoint your coworkers, your friends with your disease. We fear for our life, for our health, for our future, because we don't know what's going to happen. So trying to focus and kind of shift your focus from your disease to your health is something that can be very beneficial. And I'm not talking about ignoring your disease, sweeping it under the rug and forgetting about it. No, not at all. But if you just focus on things that serve your health, that are more, that contribute to better health, that are more beneficial to your health, other than just brewing in this wave of information about the disease and the scary stories, that will already help you a lot. When we talk about hormonal balance, another hormone that I would like to touch upon is melatonin. We have this pituitary gland that releases melatonin, and it helps control the way we sleep. Melatonin is not just for sleep. Melatonin is also an antioxidant. That's why it is recommended for patients with endometriosis. I'm not a fan of a synthetic melatonin because it causes more side effects in the long run. You can address melatonin production naturally and holistically because pituitary gland is very sensitive to electromagnetic fields. Those are in phones, computers, microwave, heating pads, hair dryers, pretty much things that are plugged into the power source. So if in your bedroom, in your space where you sleep, if you just put your phone and your computer, if it's in your bedroom, on an airplane mode while you're sleeping, if you make sure that you stay away from the microwave, and the microwave is not in your bedroom, even if it's turned off. If you need this heating pad, don't leave the electric heating pad overnight. Switch to a hot water bottle so that your melatonin production, your antioxidant, is not disrupted. Another important thing to mention is that all hormones are built from cholesterol. So if you are put on a cholesterol lowering medication, make sure that your level is not too low. Because if it is too low, then you don't have building blocks for your hormones, and then you won't get any cortisol built up, progesterone, estrogen, you name it. So keep an eye on that. And when we talk about hormonal balancing, the whole balancing act happens when our hormones are processed correctly. They go to where they're supposed to go, and then the excess is excreted. The organ that is responsible for that process is our liver. Liver health is extremely important in this aspect. And next Saturday, we're going to talk about liver health and a little more about hormonal imbalance. The main thing in conclusion that I would like you to think of hormonal balance as is hormonal balance is an orchestra. It has a tuba, progesterone per se, a piano, a violin, and it has a conductor that makes sure that everybody plays what they're supposed to, the right notes at the right time, and they're playing the right instrument. And that conductor is our brain. Everything has to be in sync. The orchestra always has to rehearse and play together. You never see them play separately. That's what's going on with our hormones. Doctors usually use a very one-sided approach. Like, okay, you don't have progesterone, here's more progesterone. Oh, you don't have estrogen, here's more estrogen. But this one-sided approach causes a lot of issues at the in the long run, because we need to address everything in sync. The best way to check for hormonal balance is using a Dutch test. It's a dry urine test. Blood test is not that reliable because our hormone levels change every millisecond. And as you remember from this video, cortisol affects so many different organs. So if you're sitting in a chair getting ready to give blood, you are stressing out because you are in a hospital, there is a needle involved, and it will mess up your hormonal balance right there and then. So dry urine test is more reliable. I can give you a couple of practitioners that can help you with getting that test and also getting it interpreted. So let me know if you would like to get that information. If you're not ready to invest in a Dutch test, but would like to know what your hormonal imbalance may look like, depending on what symptoms you're having, send me a message. I will send you a free hormonal imbalance assessment. It's a pretty cool report. It's like 25, 26 pages long, and you can read all about what kind of disbalance and imbalance you might have. So hormones, I hope you realize now that hormones are important. It's not just about sex hormones, and we need to address them simultaneously. And this is pretty much all I wanted to tell you about hormones today. We'll talk more about hormonal balance next week with the liver health. I'm opening the comments, and while you are writing your questions and while you're typing, welcome everybody. Just a couple of reminders. If you need help with stress management, let me know. I have a free video I can send you. It comes with different tools that you can use, and also you can utilize me as a coach to help you build a strategy, and that is all comes with that free video. Next Saturday, we're talking about liver health. Same time, same day, Saturday at 9. And I mentioned in the very beginning my 90-day program. Just a reminder, that program happens 3 times a year only, because everybody gets support and personal support. Next group will be in May, and the registration is already open. So if you go to my link in bio, you can register for the next group in May. Let me see the question. Not that it matters anymore, but during lovemaking, what about cortisol? Is it good or bad? That is a very good question. I actually was wondering about that myself when I was, researching and dealing with stress and stuff like that. And I thought, well, if the heartbeat increases the breathing and it puts your body in a stress mode, what happens when you are having an intercourse? And apparently our body is very, very smart. So when we have a sexual arousal, it actually decreases the cortisol. It releases other hormones that are beneficial for that. Now, when it comes to endometriosis, we all know that many of us have pain with intercourse. So we can get aroused, but we still get kind of scared because nobody wants to get pain, right? So in this situation, sex may be causing a stress response instead of a good feeling arousal. Yes, a lot of pain. I found that everybody in my program asked me, Anastasia, what did you do to relieve pain with intercourse? Because I say it in my posts and in my story. Endometriosis pain with intercourse caused me my first marriage. It was because it was scary, it was painful, and I cannot really answer what actually helped with the pain. I think it's overall whole body approach. When you start addressing your whole body, you will not even realize what may change. We are so conditioned by doctors to think like doctors, that if we have pain here, we have to take a pill or do something just to help this one thing. But that's not how our body works. If you are wanting to know what whole body approach is, join my next group. You will learn all about it. You will experience it. You will apply it. And who knows what you will notice. I think it's a personal question. Has that aspect of your life has gotten better? Yes, it has gotten much better. I'm not afraid of that. I don't have pain with sexual intercourse anymore. So yes, that is much better. Any more questions? If you have any questions that pop up, if you're watching this in replay, send me a message. I will be glad to answer any question you have. Thank you so much for spending your Saturday with me. I'll see you next Saturday. Have a great weekend. Bye-bye.